Hello and welcome to St. Dominic's Weight Loss Solutions. Our program is a nationally accredited bariatric surgery center. We are so glad you chose St. Dominic Weight Loss Solutions as our physicians have over 30 years of weight loss surgery experience. First off, let's look at the qualifications to be a surgical candidate. Individuals with a BMI, that's body mass index, of 40 or more, or a BMI of 35 with the presence of obesity-related conditions. You must be an acceptable operative risk, an understanding of the risk and benefits of weight loss surgery. We would ask that you do not smoke or are in a smoking cessation program. No uncontrolled psychological problems, obesity that is not caused by endocrine-related problems, and you must be 18 years of age. The risk factors of obesity with a BMI of greater than 30, 55% increase in mortality, 75% increase for stroke, 70% increase of coronary artery disease, and 400% increase in diabetes. Medical conditions and diseases related to obesity: diabetes type 2, hypertension, coronary artery disease, congestive heart failure, sleep apnea, asthma, urinary incontinence, GERD or gastroesophageal reflux, low back pain, immobility, and depression. Our goals of bariatric surgery is improve health, improve quality of life, and increase lifespan. How bariatric surgeries work: malabsorptive component, anatomical restructuring, that is done during bariatric surgery. The bile and pancreatic secretions that are necessary for digestion now reach the food further downstream in the small bowel. This delays the digestion of food and causes incomplete digestion and absorption. Example, gastric bypass. The restrictive component: the volume of the stomach is greatly reduced. Only a limited amount of food can be eaten before a person is full and their hunger satisfied. Example, gastric sleeve or lap band. Surgeries used to treat obesity: the Roux-en-Y gastric bypass, which is both a malabsorptive and restrictive component. The surgery really is a combination of both. A gastric pouch is formed, which would be the restrictive part, and the digestion, of course, is delayed as the stomach is bypassed and digestion happens lower. The stomach is left intact as it has adequate blood flow. The vertical sleeve gastrectomy. A sizer is passed through the esophagus into the first part of the small intestine. The volume of the stomach is decreased, forming a tube-like structure with removal of approximately 80% of the stomach. There's the laparoscopic adjustable gastric banding. We do not do this surgery now. We now take more of those and convert it to either the sleeve or the bypass. Surgery details. How the surgery works: the Roux-en-Y gastric bypass. It's malabsorptive and restrictive. The small pouch restricts the amount of food, while the bypass of the stomach and the duodenum restricts the body's ability to absorb calories. Time in the operating room is usually 2 hours, with a hospital stay of 2 to 3 days. Time off work usually 2 to 3 weeks. Of course, the vertical sleeve, it's a restrictive process, removing approximately 80 to sometimes 90% of the stomach. Time in the operating room is 1 hour. Hospital stay is 1 to 2 days. And then outpatient surgery may be an option for some patient, as it has been during our COVID pandemic. Time off with that is also 1 to 2 weeks. Expected weight loss: the Roux-en-Y gastric bypass, 70% of excess weight at 2 years. The vertical sleeve gastrectomy is 60 to 70% loss of excess weight at 2 years. Lifestyle changes. Research has shown that successful weight loss patients do the following: take daily bariatric-specific vitamin and mineral supplementation. All procedures will require a multivitamin for life. In addition, there may be other supplements that may be required for a certain period of time postoperatively. Exercise daily. Follow the recommended nutritional guidelines. Follow the recommended nutritional guidelines from dietitian, such as protein should be consumed first and portion control is key. And then have a strong support system available and learn to cope with emotional challenges. Potential problems. With Roux-en-Y gastric bypass, there could be a leak, dumping syndrome, bowel obstruction, ulcers, stricture, vitamin and mineral deficiencies, and anemia. Vertical sleeve gastrectomy problems could include leak, reflux, inadequate weight loss, or weight regain. Surgery risk and complications could include death, heart attack, stroke, DVT, pneumonia, injury to other intra-abdominal organs, bleeding requiring a blood transfusion. These are greatly reduced by completing the workup required for surgery. Bariatric surgery improves or resolves obstructive sleep apnea, 75%, cardiovascular function, 95%, hypertension, 92%, gastric reflux disease, 98%, type 2 diabetes, 95%, polycystic ovarian syndrome, 79%, venous stasis disease, 95%, and urinary incontinence, 87%. Our program integrates multiple disciplines for a comprehensive approach to helping patients. We provide nutritional counseling and follow-ups, exercise and fitness guidance programs, hospital and supporting staff dedicated to the needs of bariatric patients, behavioral health professionals, continuing patient education, and a long-term follow-up program. Our surgeons include Dr. Jonathan Atkins, Dr. David Carroll, who's our medical director for the program, and Dr. David Miller. Your steps to bariatric surgery: information session, which you're completing now, insurance verifications and requirements. All insurances are different, and some insurances require 3 or 6 months of medical weight management before you can have surgery. Our pathway coordinator will advise you on your benefit requirements after insurance approval has been completed. Medical weight management if required. Our medical clearances, the two for this program that we require, are primary care clearance. Obtain other clearances recommended by the bariatric surgeon. During your initial consultation with your surgeon, he will notify you of any additional clearances, as this is a case-by-case basis, and a psychological evaluation. You have a series of outpatient pre-op testing, EKG, pulmonary function test, arterial blood gases, and chest x-ray, and those are done on your preoperative testing with the hospital. There's also a COVID test that would be done with that as well. That's usually a week to 2 weeks before surgery. You also have an education class, and then insurance verification, once again, before surgery. You'll have a pre-op office visit with your surgeon, and that is where you'll sign your surgery contract, and then you will pre-admit with the hospital. Financial and insurance information. All insurance companies and policies are different. Please take this time to call your insurance company and discuss with them your bariatric benefits. Once again, medical weight management, that is your insurance if it requires 3 or 6 months of medical weight management, depending on your policy. And then deductibles and out-of-pocket fees are paid before surgery. Upon completing this information session, please submit your patient history forms and insurance information for verification to our clinic. Thank you for attending our information session, and we look forward to assisting you on your weight loss journey.